Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is supervision for supervisors, and it will be presented by Shelley Victor.
What is it when we talk about supervision? What is it that is meant by the term supervision? When I discuss supervision, I'm talking about supervision best practice of the highest level. So effective supervision begins with a relationship between the supervisor, who should be more experienced than the supervisee. And I say should be because that is not always the case. And that would be an example of supervision that will not be most effective. And in this relationship, what's really one of the primary goals is to have trust and honesty that is developed. And we have a novice, someone who is new to the profession, who is moving along a continuum, so that they're starting at a level where they have no experience, and then they are moving to independence where they don't need supervision anymore. And so the positive relationship is the key to the desired outcomes for the supervisee. If this relationship does not develop, this positive relationship, it's difficult for the rest of supervision to be effective, because in essence, what you have is one or two people that are closed off to communication and knowledge that's necessary for the profession that the supervisee is going to be in. So supervisors may be supervising someone who is less experienced. When we think of someone with less experience, we typically think of a student or a new employee. And so they need to build a set of skills. We might think it could also be what we call an experienced peer who is changing job settings or may change work based on a new job description. And therefore, they may not have the skill set necessary and therefore may need a supervision. It could be someone who's not in their profession. So you may be a manager of a rehabilitation team, also supervising occupational therapy, physical therapy, nursing, and you may be a speech language pathologist. In those cases where you are supervising someone who is not in a profession that you belong in or that you're part of, you need to learn about that particular profession. What are the important points that that particular professional should be doing when they are seeing clients or patients? In addition, some people are supervising groups, such as a team, a department, or an organization. And supervising a team may be a little bit trickier because you now have more than one person. And so there may be differing opinions within the team, different personalities within the team that the supervisor must deal with. And so having this focused goal of the team will connect the team and then move them forward.
I also invite everyone to review our current offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.